Hello, and welcome to video number 4 of the Frequently Asked Question series. Today's video will address your question of when will life get back to normal and what will life look like after the pandemic. Many people have recently been Googling when will life go back to normal and what will life look like after the pandemic. In a study done by the Association for Canadian Studies, 1/3 of Canadians do not feel that life will return to normal once the pandemic is done. So why are so many of us wondering the same thing? Well, it relates to human beings' fear of the unknown. Humans generally thrive on certainty and knowing what to expect from life. The COVID-19 pandemic has thrown most of that certainty and normality out the window, so to speak. Now, due to the pandemic, quarantining, isolating oneself, and physical distancing are practices we will need to keep doing for the foreseeable future. But we are not used to quarantining and isolation, and it is impacting people's mental health. This leads us back to people's need to know when and if things will get back to normal. So in response to our need to know, we are attempting to seek answers from various sources in order to make sense of the uncertainty we are experiencing. Generally, in times of uncertainty, we rely on each other to talk through, make sense of, and cope with what is happening. However, given the current situation with the pandemic and the need to isolate oneself, getting together to make sense of what's happening so that we can alleviate our uncertainty is simply not possible, or much more difficult. Instead, we can rely only on those we live with, people we can call on the phone, or we need to find entirely new ways to cope with the current situation. The COVID-19 pandemic has certainly transformed the way we go about living our lives. Many people feel that the pandemic has prompted these changes, such as working remotely. However, believe it or not, many of these changes had already been in existence for quite some time. What is new, however, is the amount of people who are working, gaining education, shopping, and seeking healthcare via an online platform. The COVID-19 pandemic has greatly accelerated the number of people who have been mandated to work, learn, shop, and have their health concerns addressed from home due to the health concerns posed by the pandemic. Education being offered outside of the classroom is not a new phenomenon, and one that has been developing over the last 130 years. Education has been offered via correspondence since 1892, starting with the University of Chicago. Likewise, televised classes began being offered at the University of Houston in 1953. Once we reached the 1980s, more and more people were learning online, and starting in the 2000s, many universities offered whole programs online. Therefore, while this may seem new to many people who have not yet been exposed to it, it is something that has been happening more and more over time. Since the introduction of the internet 30 years ago, learning online is not only possible, but standard as part of many college and university programs. Telecommuting was developed as a solution to reduce gasoline usage during the oil crisis in the 1970s. IBM, for example, has encouraged working from home since the 1980s, and as of 10 years ago, 40% of its workforce was working remotely from home. Working remotely offers those that have the option great flexibility and time savings. Those with young kids can jointly look after their kids while working from home. Also, not having to commute back and forth from work can save people a great deal of time, which they can then use to spend more time with their family, friends, or get chores finished. Working from home has been made possible and is easier due to the internet, advances in technology, and the ability to video conference with one's colleagues when needed. Many people have stated they are satisfied with this flexibility, the stress reduction it gives them, the work-caregiver balance, and lack of commute that working remotely has given them. Working remotely can also save people a lot of money, which they then don't have to put towards transportation. Some companies have even noticed that their productivity rates have increased while their workers have been working remotely during the pandemic. Further, those same workers state that they are reluctant to go back to their normal or pre-existing daily work life and commute. While it is true that more people are shopping from home now due to the COVID-19 pandemic, lots of people were doing this long before the pandemic occurred. Shopping from home is certainly not a new concept. Sears offered home shopping through catalog orders since 1888, if you can believe it. Milk, bread, and meats used to be delivered to one's doorstep, and the first Tupperware party occurred in 1949. Even before the pandemic began, many people were purchasing groceries, home supplies, clothes, and more online through the various online stores. Therefore, the only new thing about home shopping during the pandemic is the amount of people doing it and the amount of stores that are adapting their businesses to accommodate it. Telehealth, or health services that are provided over the phone, internet, or via video conference, has seen the greatest expansion since the beginning of the COVID-19 pandemic. Telehealth is also not new and was first mentioned as being potentially useful in 1879 by the Lancet, a well-known medical journal that still exists today. While many physical and mental health concerns have been treated through the use of telehealth as a platform, it is not taken off as fast as the other three areas we have talked about previously. It has been suggested that the COVID-19 pandemic has propelled telemedicine into people's homes faster than any other occurrence in the last century. For many people, including families with young children, individuals with complex care needs, individuals with mobility or vision challenges, and seniors, they benefit greatly from getting their physical and mental health care needs met in their homes. Many people, especially individuals between the ages of 30 and 50, feel that telehealth services are here to stay. So, as we can see, changes to education, work, home shopping, and health predate the COVID-19 pandemic. It can bring peace of mind to know that not every change we are currently experiencing is brand new and due to the pandemic. What we do know is that the pandemic has accelerated how many people are using virtual or online methods to access these four areas to meet their needs. Essentially, these changes were already in place and awaiting a time where they would become necessary, such as now. So will life go back to how we used to know it? Sadly, it's too early to answer this question with any certainty, as things are still changing on a daily basis. While we as human beings generally prefer normalcy and familiarity, sometimes change is what's required in order to improve life in general. Also, we need to examine the word normal. Normal has different meaning for each of us, each individual, family, community, and country. So really, there is no universal definition of what normal is. Further, if life were to always stay normal, how would things ever change? Change is a common and necessary development in our lives and allows us to be able to advance and better ourselves as a human race. So what will life look like when things go back to normal? Likely, life will be similar to what it was pre-pandemic, but with some important and necessary changes. It is important to acknowledge that this change can be for the better, and that these new processes and procedures that come from the pandemic will only allow us to live better and healthier lives. So, in the meantime, take time to appreciate the small things in life that we often forget are the big things: your health, relationships with others, and ability to be happy and productive. Something that has been successful for some people when life is uncertain and we lack control over the future is to take time to focus on the things that you can control. This could include work performance, your health, relationships, and taking time to do all those things that you've been wanting to do but couldn't because life was just too busy. Gaining control of things in one area of your life can sometimes make having little control over other areas of your life much more manageable. Once again, thank you for taking the time to listen, and we hope that this video was in some way helpful.